Hey, Dave with Align Therapy here. I am in our St. George office today, and I thought I would demonstrate a simple and easy scoliosis specific exercise that can be done at home. I'm trying to do 10 simple and easy scoliosis and kyphosis specific exercises that you can do at home that are simple and easy and still do something for scoliosis. So today I wanted to talk about a hanging exercise. I've talked about this before on this channel, but I want to go into a little more depth as far as what to do to make this specific to what you have going on in your back. So don't forget to subscribe to the channel. I'll put a link for things that you can use equipment wise to do this hanging exercise, because you do need equipment to do the hanging exercise. But yeah, subscribe and look forward to the other exercises that we're going to post. So I'm hoping to do about 10. So this one is an elongation exercise. We've already done where you sit and you try and elongate up off of your pelvis. So fighting gravity. Gravity isn't the enemy all the time. We can use gravity to help us elongate the spine. We just have to do it in a controlled way. So I want to go over how to do that with hanging. We're going to use the bars right here. There's also a way to do this with a strap and a bar and things like that. I'll put a link to that video. I have a video of how to set that up, and the equipment will be in the description as well. So look in the description for those things to learn more about what you can use. But the idea with elongation, just like in sitting elongation, we're trying to get the spine to elongate and lengthen. So if we have a curve that's like an S or a C shape, and we grab both ends and we pull, that curve straightens out and elongates. We're trying to use gravity to help us do that, but a couple of things that we need to do specifically is we have to make sure that we're controlling what the spine is doing. I get asked the question a lot if an inversion table would be good for scoliosis. The problem with an inversion table or any type of traction or hanging upside down is it's very passive. There's not really an active component to it. By active, I mean control. When you're in an inversion table, you're kind of at the mercy of the inversion table. You're just leaning back and letting gravity stretch the back. Sometimes that can really help with those that have back pain with scoliosis. But as far as controlling and doing it specific to the curve, that isn't as effective. We need to learn how to control what's happening in the spine, not just passively elongate it. If that were the case, we would use the racks that were used, back in the 1500s or something like that. Not to that extent, hopefully, but so let's go through. I'm going to show you how to do the hanging exercise with the bars. This is something that is doable for most people with scoliosis. There's not a ton of concern or risk other than if you have shoulder problems. So if you have shoulder, hand, elbow problems, you may want to hold off on doing this one. But if your arms are in good shape and you can hold on, and if you don't have a significant problem in the spine, then you should be okay with this. Problems that I would recommend not doing this, one is if you have a spondylolisthesis, meaning a slippage of the vertebrae, one vertebrae on the other. I would probably hold off on doing this. A lateral listhesis, which is a slippage to the side of one vertebrae on the other. So if you have any instability in the spine, I would recommend not doing this on your own, and I would recommend specifically working with someone who is specialized in treating spine and scoliosis to do that. So yeah, I'm going to let you make your decision on that. Most people should be okay with this, but if you have any of those problems or you have significant back pain, I would probably work with someone specific on this. Preferably a Schroth therapist, because they've been trained specifically how to do this. So the first thing we're going to do with these bars is we're going to find the bar that's about at eye level. So for me, that's this bar right here. So we're going to hold on to the bar at eye level. We're going to put our feet underneath the bottom bar. And then we're going to come down and we're just going to let the back stretch. So if you notice, I'm not just hanging. I'm not going from a top bar and just hanging. I'm coming down and I'm letting my back stretch, letting my back elongate, trying to relax the muscles in my back to allow that to happen. And I'm also breathing. So I'm breathing deep, trying to expand through the back. Most people, when they do this exercise, will feel their grip, because that's usually the limiting factor with this. They'll feel usually a lat stretch, which isn't a bad thing. That's actually a good postural stretch. But what we're really trying to do is in the spine where the curve is, whether that's the low back or the upper back, I want to feel the elongation of that area of the spine, which takes some work. It takes a little bit of focus on what's happening in the spine and allowing expansion through that area of the spine. So that's something to be aware of. So as you're hanging in this position, trying to allow this area to open up and breathe and try and feel that expand through that area. One thing that I want to show, I'm going to move the camera a little bit here. From the side, if I'm hanging, we don't want an excessive lordosis, so I don't want to arch my back significantly. I want to keep a soft S from the side. So we also don't want to keep the back rounded like this. We want to allow it to come down and have the natural curve in the low back and the natural curve in the upper back. Breathing, letting those ribs expand and controlling your exhale. So we're breathing in, we're breathing out, we're controlling that inhale and exhale. So really what we're looking at with the hanging exercise is control. We're looking at controlling what's happening in the spine. So if you're doing this exercise and you don't feel controlled, then I would hold off and work with someone that knows what they're doing. If you feel like it's a good exercise and you feel really good elongation, fantastic. Breathe about 8 times, stand back up and do that about 3 rounds to try and increase the elongation of the spine. This isn't where we stop with treatment with scoliosis, but this is usually where I start to try and allow the spine to elongate, get people to feel what's happening in the spine so that we can then move on to harder exercises. In regular Schroth training, we do more complex hanging exercises. We do more expansion into the concavities. We do more control with the rotation, all those things. But that's beyond the scope of this video. So if you have scoliosis or kyphosis, this is a great one for kyphosis as well. Sometimes we'll reverse our hanging where you're hanging facing away from the bars. Maybe that's for another video. But if you have scoliosis or kyphosis and you want some help in learning things like this that are specific to your curve and specific to what's going on in your spine, give us contact us, give us a call, shoot us a text, something like that, or leave a comment in the comments of this video. And hopefully this was helpful. This is actually an exercise that most of my adult scoliosis patients really love. If they can tolerate it through their shoulders and their hands, they really love doing this because all our lives were compressed with gravity. This is a way that we can elongate and create more space. And most of, specifically adult scoliosis with degeneration, this is something that they really enjoy and really like. So hopefully this was helpful. And remember, if you want more instruction on it, I would highly recommend seeing a therapist that's trained in this. So again, thanks for watching. Look forward to the next one. Have a good one.